Hello, everyone, and welcome to yet another live at Parentune. Today's session is going to be about booster vaccination for school entry children and everything a parent must know about that. Childhood is a time of fun, freedom, and mischief. And while every parent wants their precious ones to enjoy this stage of their lives, their childhood, they also know the value of discipline and structure in their lives. And that's why you, as a parent, you would be following a good habits and healthy discipline when it comes to their food, their sleep, or their playtime routines. But a very important aspect is also the immunity discipline, a discipline that all parents must have to ensure their babies and children are protected from vaccine preventable diseases. This immunity discipline is important for our children as they start going to school and can be at a risk of exposure to infections like diphtheria, tetanus, pertussis, and polio. Children today have plenty of challenges on their plate, and as parents, we want them to be ready to face the world safely. So, on that note, let me introduce you to our expert for today's live session, Dr. Vivekanand M. Kustagi. Welcome, Doctor.
Hi, good afternoon.
Right. Dr. Vivekanand M. Kustagi is an esteemed doctor practicing pediatrics in Bangalore, and he's been doing that for over 19 years now in places like Rajshekhar Hospital, Deepak Nursing Home, Cloud9 Hospital, Manipal Hospital. And Dr. Kustagi specializes in adolescent medicine, general pediatric care, vaccination and immunization, and emergency care. Um, Doctor has also been a member of the Bangalore Pediatric Society and the Indian Academy of Pediatrics. So once again, welcome, Doctor. And my first question to you today is with respect to building immunity. So we normally look at building immunity through timely immunization for school entry children. Could you please tell all the parents who have joined us today a little bit more about that?
Okay, so it's now 25 years of practice now,
Oh,
and
wow.
I've been I've been seeing now kids, their mothers, and the third generation now. So time flies. So we vaccination has been evolved over years. So vaccination is an important concept in child care. So any mother or any baby that is born should have vaccination. So vaccination can be from birth till 18 years of age. Even now, there's something called adult vaccination that are come into place where adults also get vaccinated. So vaccination is important. It ranges from BCG till pneumococcal vaccine till polio. So, it important thing is vaccination that helps to build immunity against all diseases, especially during school age and school entry, where the kid comes from a closed environment and then goes to school. They are exposed to number of diseases. So, vaccination plays an important role that creates as a barrier between the disease and the child and helps in reducing the number of infections. Sorry, I lost you. I'm not able to hear you.
Sorry, Doctor. So I wanted to ask, how important is this for this age group in particular, the group of children that is entering school, for the first
See,
time?
yeah, entry to school is a complete change of thing for any kid, both physically, emotionally, and immunologically too. So, initially, a kid will be in a closed environment where he'll be only exposed to parents. Now the kid is thrown to the school where number of kids are more, cross infections are more. So when the cross infections are more, then we have to have a protocol of vaccination that will protect our children from number of diseases. So that's why the importance of school going vaccines. Any kid going to school, we tell please don't miss vaccines. Please don't miss vaccines. But during school age, very important. Example being flu is very common, which we recommend. Your regular vaccines, which we tell at 4.5 to 5.5 years, a school going age would be DPT, your injectable polio, your hepatitis B, chickenpox, MMR, other vaccines, which we recommend during school going age group.
Right. So, doctor, are all these booster vaccines given at the exact same time when a child is first entering school, or what is the exact age at where all these booster doses are given?
See, generally, we have to understand what is a booster. Booster is post primary vaccination, is a booster vaccine. So, there are so many case scenarios where in COVID, parents were very afraid to come to the clinic or come to the hospital and take vaccinations. We are seeing so many people coming now for the first vaccines. So, we don't call that as booster, we call them as primary. So now we're talking of boosters, assuming that you have taken all the primary doses, then we give all the four boosters at school going age group. We don't give it all together, it is given separately. So that means when you come at the first visit, we give a combination of your DPT, injectable polio, and hepatitis B. And the second visit, it would be, you'll be giving your MMR and chickenpox. So generally, we don't give more than 2 or 3 vaccines together. It will be spaced over a period of 6 months to 1 year of age.
Right. Doctor, taking that into account, so are all these injections, separate injections? There are no combination booster vaccines for school going children?
Yeah, we have a combination vaccines which we give for school going age groups. One being a combination of your DPT, injectable polio, and is a combination which we give. We give MMR separately, chickenpox separately, but we give combination of injectable polio and DPT at school going age group.
Right. Doctor, when it comes to polio, so for is this age group, is polio infectious and who is at risk to get polio?
Oh, very good question. So, polio was a big thing about 20, 30 years back. Now we are talking of eradication of polio now. Polio is definitely infectious. It spreads from one person to another. So, how does it spread? It spreads through fecal-oral route. That is, it could be contaminated water. It can definitely spread from one person to another. It's like any other infectious disease that it spreads through fecal-oral route. It is infectious.
Right. So, doctor, are school going children more susceptible to this infection then?
Yes, kids less than 5 years are always more susceptible for polio infection. Basically, it's a viral infection that comes. So that's the reason recommendation of polio vaccine is of great impetus for children less than 5 years of age. So that's the reason most of all the governments in the world are trying to eradicate polio from our planet. That's the reason a lot of impetus is given on polio eradication.
Right. So, doctor, are there any other factors that affect the contraction of polio?
Yes. So the factors that affect polio could be so many. It could be the environmental factors, very common in the developing countries like us, where it is more common. As I told you, the infections are through fecal-oral route, where the sanitation is a major problem, and overpopulation, overcrowding is again a major problem. More common in developing countries than developed countries. So definitely for our scenario, this again becomes more important. Touchwood, in India, we are trying to eradicate polio. In the world, there are about only 2 or 3 countries now having active cases. The countries being Afghanistan, Pakistan, and Nigeria. So they're the countries where active polios are there. So last year we saw about 13 to 14 cases in Pakistan and about 200 cases in Afghanistan. So It is quite a concern, and the factors, as I was telling you, major is your socio-economic status and your overcrowding.
Right. So, doctor, can you just also elaborate a little bit about the symptoms of polio for children who are affected?
So polio, the symptoms are varied. Okay, so whenever a kid comes, basically polio is a viral infection. It is an RNA virus. It's a little technical thing which I'll be telling you. It's an RNA virus of a picornovirus family. It's an enterovirus. It's a single-stranded DNA. So, as I told you, it spreads through our fecal-oral route. It has symptoms varying from fever phase, non-paralytic phase, and paralytic phase are the phases of your symptoms in polio. This the common, if 100 kids are suffering from polio, most of the kids come with fever phase where they only come with body pain, fever, headache, and they generally become all right within about a week or two, where most of the cases manifest like that. The other cases, maybe you're looking at about zero point 0.6 to 0.8% of the cases, come with a paralytic phase where they come with intense muscle pain, weakness of the lower limbs, which progresses. That would be a paralytic phase. The few uh, symptoms of polio that can be a little more life threatening, like bulbar polio, where it affects your medulla oblongata, where it also causes paralysis of the respiratory muscle, where the person can't breathe and he can die because of polio. So basically, polio would be a more devastating disease, causing a lot of long-term problems, and a lot of morbidity than mortality. But muscle pain is very common in polio. The
Right,
other
doctor.
differential diagnosis, the other differential diagnosis when we see polio is would be it could be Guillain-Barré syndrome. We basically classify it as acute flaccid paralysis. That's what we tell. Where any kid who comes with acute flaccid paralysis, it is the thing for us as a doctor. We have to intimate to the government, and we have a chart that is given to us every month by the government where we have a thing called we have to tell AFB measles. These are all reportable diseases which, as a doctor, compulsorily we have to report it to the government. Okay, the other differential diagnosis would be Guillain-Barré syndrome. Is another syndrome which we have a differential diagnosis when a kid comes with poliomyelitis.
Right. From what you've described, polio can be a devastating disease for those affected. So, what are all the steps that a parent needs to take to protect their child and immunize their child against this disease?
See, the good thing about this disease is it's preventable. Very important. It's a preventable disease. How can we prevent? Vaccinate our child. Very important. Vaccinate, vaccinate, vaccinate. So you have to spread the information that polio can be prevented. We can prevent the devastation of the disease by adequate vaccination. Without vaccination, there's no prevention of this disease. So, as soon as the baby is born, we have to vaccinate against polio. That's called birth dose polio, which we are still following in India, followed by our polio vaccination as per our immunization schedule, which I'll be talking to you a little later.
Right. So, doctor, when it comes to the polio vaccine, you've explained its importance and the steps that a parent needs to take. So, are there any side effects to this vaccine, or is it completely safe for children?
See, any vaccine has a side effect, but the advantages of the vaccine is far, far, far superior than your vaccine not giving the vaccine. Generally, oral polio vaccine is very safe. The only problem with is we call this as VDAP. It's vaccine derived poliomyelitis that can happen in 1 in 3.5 million doses of administration. That's seen in oral polio. But in injectable polio vaccine, generally nothing. But apart from fever, injection site pain, otherwise nothing.
Right. So, doctor, if you could also, share the schedule of polio vaccines that every child needs to stay protected throughout the course of their childhood.
So the vaccination schedule as per our IAP recommendation, one, and according to our EPI recommendation is two. So there, the vaccines which are there in polio are two types. One is an oral polio vaccine, other is an injectable polio vaccine. Now in our country, we are phasing out from oral polio to injectable polio. So what are we doing is at birth, we are giving birth dose of bivalent oral polio vaccine. Then after that, we are giving as per IP schedule at 1.5, 2.5 months, and 3.5 months your injectable polio in combination with your DPT, hip, hepatitis B. You are giving a booster at 18 months in combination with your DPT and hip vaccine. And at school age, at 5 years, we give in combination with DPT and injectable polio. So you're giving at 1.5, 2.5, 3.5 months, 18 months, and 4 to 5 years of injectable polio. Oral polio at birth, that's one thing. In our government, what are we doing is we are also doing birth dose polio. We're also giving injectable polio now. In between, there was a shortage of injectable polio. Then we were doing something called fractional dose polio vaccine, where one-fifth of the dose of injectable polio was given intradermal, two doses at a 4 to 6 weeks interval. So now it is at 1.5 birth dose, 1.5, 2.5 months, 9 months, and then it would be at 5 years.
Right. So, doctor, after 5 years, do children require any further booster doses of polio vaccine later on in life?
After 5 years, generally no. It is for kids less than 5 years as per recommendation, not after 5 years.
Right. So, there is no chance of contracting polio later on in life after they've crossed this stage of infancy to 5 years?
Generally, no. Generally, no. Okay.
Okay.
So, as we got our immunity levels up, we generally don't get polio after 5 to 7 years of age. Maybe we get other viral infections, but polio is very, very rare.
Right.
Because when we tell recommendation, it is for the whole population. You understand? So whenever we have a recommendation, we can't take at 0.1%, 0.2% because the costing for the country becomes more.
Understood.
So that's the reason we give it less than 5 years because that's the more common age group. There's no
Understood.
harm in giving.
Okay. So, doctor, you mentioned, the oral polio vaccine as well as the injectable polio vaccine. So now, if you look at both of them, could you explain to, all the parents who have joined us today, what the difference in, what they protect against? And is, a lay question could be, are oral polio drops more effective than injectable option that is available?
Okay, so let us talk about both the vaccines now. Okay, so oral polio vaccine and injectable polio vaccine. Oral polio vaccine is called Sabin vaccine, and injectable polio is called Salk vaccine. Okay, so the concept of oral polio vaccine was it was cheaper, and whenever you give oral polio, it helps in increasing your mucosal antibodies and your gut antibodies. So injectable vaccine, you give the antigen, so your antibody response is better. So there is definitely a difference between oral and injectable because when you give oral vaccine, the immunity memory in the person will be less compared to an injectable vaccine. That was the logic of us to give pulse polio over a period of so many years, like mop up, mop up, mop up. So that's the reason we phased out to injectable polio, where your immune protection is more, your immunological memory is better. That's why injectable polio vaccines are much better. Two, the side effects with oral polio vaccine, as I was telling you, vaccine-derived poliomyelitis would be there. That is covered by your injectable polio. So, injectable polio is much better than your oral polio.
I think doctor has, elaborated and told us all the details of both the oral polio vaccine and the injectable polio vaccine and the importance of each and how injectable polio is more beneficial uh, as of now. So, doctor, coming to other booster vaccinations aside from polio, could you once again elaborate on the other booster vaccines that are recommended for school entry children?
Okay, school entry children around 4 to 5 years of age. So the other boosters which we generally use are your DPT booster. It's DPT is DTaP plus injectable polio. We also give MMR booster. We also give chickenpox booster. Now we're giving flu boosters too. Typhoid vaccine is another vaccine which we recommend at 4.5 to 5.5 years, provided you're not given your second year typhoid vaccine. If you're given a conjugated typhoid vaccine at second year birthday, then your 4 to 5 years, that typhoid vaccine is not required.
Right. Doctor, thank you for all that information. We have a lot of parents joining us today, and they've been sending in questions for you. So we're going to start off with some of those questions now. Our first question is from Tina. Tina would like to know, she says, my baby is 5 years old and still not vaccinated. What should I do as of now?
Okay, so as I was telling you, since the advent of COVID, a lot of parents have missed their primary doses. So if you have not vaccinated, assuming that you not got your primary schedule, that is your 1.5, 2.5 months, and 3.5 months, then we may have to restart your schedule at 4.5 to 5.5 years, like zero, and then go from there. And there's no harm in restart doing it the whole set again. It has more benefits than not doing it. Please get it done.
I hope doctor's advice helped you, Tina, with respect to what to do now. Our next question is from Khushbu. Khushbu would like to know what are your tips for her before taking her child to vaccination. I think this is a question that all parents want to know about, what are the general guidelines they should follow before any vaccine.
See, whenever a parent is going to vaccination, they'll be having a lot of anxiety. What would happen to my baby? Would it have fever the whole night? What should I do? What are the side effects of the vaccination? Okay. So generally, the vaccines are safe, and it's generally safe to the baby, and generally the side effects are very, very rare. Since last 25 years of my practice, I've hardly seen any post-vaccine complications till now. One. Two, whenever you go to vaccinate, whenever you're getting a vaccination, I'll tell you first after the vaccination, then I'll tell you what is to be done before you come to the clinic. Post vaccination, very important advice, stay in the clinic or in the hospital for 5 to 10 minutes post vaccination. Please don't go in a hurry back home. Please stay in the clinic or in the hospital for 5 to 10 minutes post vaccination. Two, if the baby is not feeding well, has very high fever, lot of irritability post vaccination, please contact your doctor. Before vaccination, please don't feed the baby immediately before vaccination, because sometimes when we put some oral drops like your polio drops, rotavirus drops, the kids would vomit. So maybe feed about 10-15 minutes before the vaccination, but not 5 minutes or 2 to 3 minutes before vaccination and come into the chamber. Two, use regular loose clothing. Okay. And Otherwise, generally should be all right. Nothing much.
Right, doctor, I thank you for those guidelines with respect to what needs to be done before taking a child for vaccination. When it comes to our next question is from Suman, who would like to know: are there any contraindications or situations where my child should not receive a specific booster dose or booster shot?
Okay, so I would talk about general contraindications. Okay, so whenever the vaccines are divided into live vaccines, killed vaccines, and toxicided vaccines. So whenever a kid is taking a live vaccine, example oral polio vaccine, MMR vaccine, the kid should not be on any oral steroids for about 4 to 6 weeks, should not be on any anti-cancer drugs for about 3 months, should not have any immunodeficiency diseases, then the live vaccines can be given. If a kid has a febrile convulsion post DPT, then we can't give a wholesale DPT. We have to give a acellular DPT. Whenever you have a wholesale DPT with abscesses happening, then we have to give acellular DPT again. So otherwise, there's no other contraindication provided your kid is not on any anti-cancer, steroids, or immunomodulators.
There you have it, Suman. You know the answer to your question. Uh, those circumstances and those situations wherein your child should not receive a booster shot. Doctor has elaborated on those. Um, our next question comes from Kushi. Kushi would like to know what age group is at the maximum risk of contracting polio.
You broke. I think whatever question I heard is what is the age risk of contracting polio, right? I think that
Yes.
was your question. So less than 5 years, as I told you, less than 5 years, but kids less than 6 months of age have higher risk of getting polio compared to kids of the older age. But kids getting polio after 2 years have more debilitating disease, more complications. As I told you, polio infection mimics like any other viral infection. If 100 kids are getting polio, 98% of the kids just pass off like fever, cold, throat pain, myalgia. Out of the 2% land up in complications. Out of that 0.3%, 0.6% have neurological problems.
Right. Thank you for that, doctor. Our next question is with respect to herd immunity. So this question comes in from Shahid. Would like to know the importance of herd immunity and how can his child's vaccination help contribute towards it.
Very good. So I think Shahir has a little medical background, so he's asking about herd immunity. Very good. So herd immunity is basically for people of our uh, developing countries. Okay. So herd immunity is developed only from oral polio vaccine and not by injectable polio vaccine. Basically, what does herd immunity mean? That means if I have taken oral polio and I shed that polio virus in my stools, it gets contaminated, and if somebody else drinks that water, that virus again goes and then that person gets immunity. That's the indirect way. That's why it's called herd immunity. So that's the reason we give oral polio as much as possible to improve the herd immunity, where kids who have not taken the polio virus by, see, if you have 100 people in the community, 10 people have not taken the vaccine and 90 people have taken it, those 90 people protect the 10 people by your herd immunity by taking the vaccine. So oral polio works well with herd immunity. That's the logic for us to do pulse polio program.
Shahir, I hope that answered your question about how your child's vaccination will help develop herd immunity in the community. Our next question comes from Monica, who would like to know why timely DTP and polio booster vaccines are required.
Yeah, timely DPT polio boosters are required. You're talking the boosters, assuming you have taken your primary. So over a period of time, your immunity levels start waning down. So that means your antibody titers come down. So that's the reason we give booster doses at 4 to 5 years of age, where your sensitized and primed immune system gets kick-started again, and you have a good immune response. That's the reason timely boosters are required. If we don't give a booster, we only continue the primary, that means you, over a period of time, your antibody response comes down and your kid's protective immune system to that disease would reduce. That's the reason timely boosters are very important.
Right. Doctor, our next question comes in from Shivangi, who would like to know, is polio still in India? Is it present still in India?
One, to answer your question, yes, no. One, we don't have wild polio viruses going around, so there's no active polio virus, that is wild polio virus causing. In India, we are seeing about 30 to 40 kids with oral polio vaccine derived polio infection, not poliomyelitis. Okay. For generally, for a layman, India, there's no polio. In the world, only two, three places: Argentina, sorry, Afghanistan, Pakistan, and Nigeria are the only three countries who have polio now.
Right. I hope that answers your question, Shivangi. And our next question is from Lokesh, who wants to know, why does his child need booster vaccine?
I think I answered the question. It is basically to improve your immune memory. If after primary dose, we give a booster dose to improve your immunological memory so that your antibody levels are maintained in your body so that your body is capable of fighting against the antigen. That is why your booster doses are important.
Doctor has explained to us the significance and importance of booster vaccines for children. Our next question is from Hari. Hari wants to know, how long does it take to show signs of polio after being exposed?
Sorry, your voice broke. Can you tell me again?
How long does it take to show signs of polio after being exposed?
Okay, it's a good question again. So, generally, let me talk to you about the symptoms. Whenever a person comes gets infected with a polio virus, so how do they manifest? They manifest with fever, cold, cough, throat pain, and things like that. Cold and cough is less, but fever, throat pain, body pain. Generally, they start. We are not. They become more infective after second week after exposure. If you're looking at your neurological manifestation, that's what I'm assuming you want to ask. Your neurological manifestation comes after 8 to 10 days after exposure. That means during the second week, the kids may come with a lot of muscle pain, muscle weakness, fatigue. That's what would happen. If you're talking of symptoms, generally 1 or 2 days of exposure, like fever, body pain, would be after 1 or 2 days of exposure.
Those are the signs of polio that are first seen. Our next question is from Ashok, who wants to know, should adults get vaccinated against polio? I do know, doctor, that you've made reference to when polio vaccines are to be given earlier, but we have parents joining us continuously, and this question has now come in from Ashok.
For adults, no recommendation for till now. It's only for kids less than 5 years of age.
Right. Lokesh, if you would like, sorry, Ashok, if you would like, you can go through the recording of this workshop, and you will see that doctor has specified the vaccination schedule for polio at various stages during early childhood, from birth up to 5 years of age. Doctor, we also have another related question, which is from Sanya. Sanya says, if I was vaccinated against tetanus, diphtheria, and polio as a child, am I still protected from it as an adult?
Assuming you are an adult, so that time injectable polio is not in India. So I think you would have got oral polio vaccine. Okay. So let me talk about DPT first, polio, and then you said hepatitis B, right? So oral polio, you have inbuilt mucosal immunity. So for you to get polio in adulthood is a little rare. Generally, we hardly see beyond 15 years to 18 years of age getting polio. DPT, pertussis can definitely happen uh, if you've taken 5 years, if you're not taking a 10 years or 15 years booster, your immunity can come down, your diphtheria and pertussis antibody levels can come down. That's the reason we recommend at 15 years of age your boosters of DPT again. And hepatitis B, definitely once in 10 years.
Right. Doctor, you've shared a lot of information with us today about the importance of the polio vaccine in particular and all the booster vaccines that are to be given to children. If you could once again, sum up the importance of booster vaccines, especially in school-going children and children who are entering the stage of where they're going to be going to school. If you could tell us about the importance and what all booster shots are to be given to this age group.
So let us talk about the school going children and their vaccination schedule. That's what we're going to talk about, right? So assuming school going children are from 3 to 5 years of age, so these are all your primary boosters which we will be giving at 3 to 5 years of age. Generally the recommendation is 4.5 to 5.5 years. So the vaccines which we give at 4.5 to 5.5 years are your DPT booster, your injectable polio booster. We also give hepatitis B booster sometimes. We give chickenpox booster, MMR booster, typhoid vaccine. If the person has not taken his second year typhoid vaccine, that is a conjugate vaccine. Another vaccine which is optional is flu shots, which most of our kids are taking it for school engagement.
Thank you so much, Dr. Vivekanand,
Yeah.
for sharing all that, important information about timely vaccinations for school-going children, for the group of children that are entering the school-going years of their life. And thank you so much once again for joining us today.
Thank you. Thank you. Have a wonderful evening too. Bye.
You too.